Thank you very much for the invitation to talk about consultant practice. My name is Griffiths. I've been a consultant upper GI surgeon at Queen Elizabeth Hospital in Birmingham for nearly 12 years now. And these are my top tips for moving from registrar or fellow to being a consultant. Number one is success is not always a straight road. It has lots of bumps, bends, and hidden beauties. And there's certainly a lot of ups and downs with upper GI clinical practice. And it's important to realize that your wisdom is going to grow as you become more experienced, and your confidence will change. This is the Dunning-Kruger effect. And I think you only quite know where you are on this slope. It's when you've sort of had a knock. But you know, the risk is you become really confident as a young consultant. Whereas actually it's your confidence and you actually know very little. And then you can take a hit when you realize that there's something could have been prevented, and then you dip into this valley of despair. And I'm hoping now that I'm on the slope of enlightenment, maybe heading perhaps to a plateau of sustainability. But of course, it's not really like that. You go up and down, depending what complications you develop. And in my field, upper GI cancer surgery, some of the complications can be very humbling, and you need your colleagues to help you get through that. We must remember that you know, taking your boat out on a calm day doesn't really teach you anything. So these this quote about how sailors gain quite a lot from the storms they've overcome is true in surgery as well as in sort of clinical practice, being a sailor. And in upper GI cancer in particular, this is a picture of the Grim Reaper playing the knight from the Seventh Seal. The knights come back from a crusade. It's the time of the Black Death, and he offers to play chess with death to try and save his life. And it can often feel like that in upper GI cancer surgery, particularly when patients develop early recurrence or bad disease. And this again is where you need your colleagues around to help and support you through these difficult times. My second tip is sort of Star Wars related. It was the 4th of May, Star Wars Day recently. But effectively you need a mentor. So think about that when you're appointed in a hospital. Think about somebody that can mentor you clinically, or mentor you to do research or a different project, leadership, management. You may have many mentors for different reasons, but try and find somebody that will back your corner and look after you and help you in the right direction, particularly with tricky clinical or political situations that come up in the hospital. And there's no reason with remote access or telephone or text message or WhatsApp, it can't be a remote person, somebody that has helped you throughout the training. So don't discount that possibility either. Third tip is you're going to do good surgery. You're going to get lots of presents. You're going to get lots of cards. I would personally, I try and keep every thank you letter, every card, any email I get sent that says thanks for whatever, I save as a PDF and keep them in a folder. Try and keep these measures of thanks. So when you're having a dark day, you can open them up and think of all the patients you've helped. Alcohol, every Christmas I've got tons of alcohol. I do enjoy drinking some of it. A lot of it actually gets redonated to the patient support group to raffle off for their prizes. Of course, you can donate these to staff members in theatre or anaesthetics or nursing colleagues. 4, you'll probably not be used to dealing with PALS complaints or complaints from the hospital when you're a registrar, because often these are dealt with by the consultant. You need to manage this in a way that you respond to them quickly. You try and address the concerns of the patients. You may not be clinically looking after them anymore, in which case you just need to justify what you did with some evidence and reflect on the complication or the complaint. Of course, some of these are unjustified and they're related to other aspects of hospital care, completely out with your control. But it's very important to try and take something from each PALS complaint, answer them objectively, try and make sure you don't have any emotional baggage related to this. Write the complaint, and instead of the thank you cards, as soon as this is done, bin them, forget about it, and move on. That's my top tip for these. 5, I think for me, I was thinking about the most interesting things that happened in my 12 years as a consultant, and these very much happened at the edge of the speciality. There's people bringing on upper GI surgery nationally, internationally, and it takes a lot of work to be one of those people. In my hospital, it's very much the things that are happening at the edge. So the exciting things for me, dealing with geneticists, for looking after patients with CDH1 mutation. It's helping ENT with some pretty funky reconstructions. It's getting referrals from patients who've had complex pediatric surgery for tracheoesophageal fistula or complex operations that are moving to adulthood. It's dealing with the research department. It's working with patients who've had lung transplants for reflux disease and dysmotility, seeing if I can offer them anything surgically to try and improve the longevity of the lung transplant. It's working with geriatricians who look after our frail patients. It's also getting involved in emergency general surgery. Everything exciting is on the edge of the speciality, or certainly the things that excite me. So find something in your job plan that excites you and makes it worthwhile going to work. This is one of the operations I enjoy doing. This is a jejunal graft. This is effectively a small bowel transplant, and we, with our colleagues in ENT and Max Fax, I harvest the small bowel, and they microvascularly plug in the blood supply to this small bowel into the neck vessels to replace somebody's proximal esophagus. And it's a very demanding operation. It's one that's very satisfying when you can see the patient swallowing afterwards. It's a very morbid operation. They end up with an end tracheostomy, which is permanent, because the operation involves removing the pharynx and larynx. But it's a very technically demanding operation that I enjoy, and it involves collaboration with other teams. And it's one of the examples of operating at the edge of our speciality. Um, 6 is just be aware of burnout. You know, you can burn the candle at both ends. You can, you know, significantly sacrifice yourself to the hospital machine because it will keep on taking. I'm pretty sure at times in my career I've not only been burning the candle at both ends, but I've been burning it all in the middle as well and sacrificing home time with the family. So just be aware that's happening. Try and book your leave. Try and make sure you're going on a course or using your study leave or doing something else nice for the weekend. Try and detach. I'd really recommend this paper, which is the sort of resilience bank account skills for optimal performance. It's written by a thoracic surgeon. He actually gave up thoracic surgery. If you scan in the QR code, it will take you direct to the paper, which is free to download. It's well worth reading and thinking about this. Top tips: prioritize your sleep and rest. Make sure you book your annual leave. I'm very guilty of not. Plan your study leave ahead of time. Look at the meetings that are scheduled, what ones you want to go to. Find a hobby. Try and switch off after work. There's always a habit of checking emails. Try and turn off all notifications. And really try and keep in touch with your friends and family outside medicine. And really try and make time for family events. See what's happening. Make sure you swap your on call for weddings or other events. I'm guilty of not doing this, but this is my advice to you. 7 is about the phases of consultants' life. And you see that in your colleagues. It's good to have work in a department which have a range of people on this phase. But you'll have consultants that are bedding into practice. They're establishing themselves. They're developing some clinical interests. Early years, you're seeking out roles and responsibilities. Middle years, you're established, you're seeking out niches. And in the final years, 10 years, I'm not there yet, but you should be focusing on being a senior consultant, mentoring the next generation. And then you can see that in colleagues who are very much winding down, their peri-retirement, they're dropping things, still valuable to the workforce. But there's many opportunities outside surgery, outside the NHS. You can look at leadership and management roles. You can be a clinical supervisor. You can be a mentor. There's roles outside the hospital with the Cancer Alliance, the Clinical Senate, the CCG, NHS England, Deanery. And there's stuff outside the NHS as well. You can do medical legal reporting. You can go into private practice, research, med tech, publishing journals, involved in the specialist societies. You can be examiner for the college. So just think about which ones float your boat and which ones might be allow you to do have a spark that's outside clinical care. 8, just be at risk. Just be cognizant of the risk of getting complaints, and just be aware that these complaints can escalate. You have to be a good team player. If there are complaints or issues about your clinical practice, face them head on. Surgery, as you can see, has got quite a high level of complaints, only secondary to occupational health medicine, psychiatry, and obstetrics and gynecology. A lot of these will be closed, but a lot of them will be investigated by an employer. Sadly, GMC referrals are increasing. This is old data. It might even be more than that now. Just be aware that a lot of it's due to conduct. So make sure you avoid that. Look at this system of civility to save lives. It's a really good TED talk to watch. Make sure you get involved in clinical governance. If there's any issues of complications, discuss these in an adult way, seek advice, make sure you're a team player so you can move on. So try and avoid trouble with the GMC, seek advice from your colleagues, take them to see your complications or difficult cases, share the load, work well within the MDT, really develop that insight for difficult cases. And when you're early on in your career, try not to take on those difficult, challenging cases. Consider some dual operating for the real complex stuff. And just be careful with new environments, new technology, robotics, that you're doing this in a standard way. And if you do get complications, make sure you follow the rules of duty of candor and try and learn from your mistakes. There's nothing worse than repeating a mistake. Make sure you learn from all the mistakes. This is quite a good paper from the Lancet. It's old now, it's 30 years old, but this is what patients wanted after an incident that might have reduced their risk of taking it further to solicitor or the GMC. A lot of them are correctable. Offer an explanation. Try your best to correct any further mistakes. They wanted to be alerted to the results of the investigation. They just wanted to be listened to and not felt to be neurotic. They wanted honesty. So make sure you're honest with patients. Make sure you fulfill your duty of candor. Write them a letter. Express how sorry you are. Express the wish to meet them, to talk through the issues with your specialist nurse or your MDT or a senior colleague. And this can go a long way to prevent escalation of complaints. 9 is really about private practice. It's not quite the money pit it used to be. Just be very careful when you enter into private practice arrangements. It's very fulfilling. I do it. I offer a private service. Make sure you're doing the same things you're doing on the NHS. Make sure I wouldn't advise you go into it quickly. Make sure you bed in as a consultant. You know what you're doing. You've got a team to look after your NHS patients, and then you discuss with your colleagues when you're going to do it, who's going to cover you when you're not in the hospital. Again, it's about communication, discussion with your management. Make sure it's written into your job plan. You get a secretary. You do it all properly. You all have your insurance, your medical legal practice has got the appropriate insurance and all that sort of stuff. 10 is just make sure you have fun. Surgery is very fulfilling speciality. The hospitals can be a fun place to be. Make sure you enjoy it. Surgery for me is very rewarding. The technical side, seeing the patients get better, curing cancer, dealing with traumas and emergency surgery, it's very rewarding, and you can't find a better job. So enjoy it and have fun. So in summary, consultant practice have lots of ups and downs. Find a mentor. Keep every thank you note, email you ever get. There's a lesson in every PALS complaint. Try to find it. Exciting things happen on the edge of our speciality. Watch out for burnout. Find your niche. There's ways to avoid escalating complaints. Private practice, do it carefully with your colleagues and with the trust on board, and have fun. It's a rewarding career. I look forward to any questions. If you have any suggestions or want to email me, I'd be delighted to take your email. And thanks for your time. Thank you.